Hi, welcome back here, Dr. Kuykendall and my lovely assistant, Lucy. Say hello.
Hi.
And so what we wanted to do today is talk a little bit about why I do what I do. And the why behind it for me is I got really, really sick when I was younger. And I was probably 16, and I had terrible fibromyalgia. I had terrible chronic fatigue. I was extremely depressed. I was searching high and low for the doctors that could help me. My mom was taking me tirelessly to all the different medical doctors. And I finally went against my will to a doctor that was a chiropractor, an applied kinesiologist, a functional medicine doctor, functional neurologist. And what he does is he looks at the underlying causation. He doesn't fix the disease process. He's not trying to fix your thyroid or fix your adrenals or fix the underlining we're going to go after and cure your body. That's not what this type of practice is. That's not what I do. What we are looking for is the underlying causes. If there's issues with your ability of your body to eliminate, if there's issues with systems that are not functioning, we just give them a little bit of support. We don't have to push them really hard and make a channel go really hard, meaning a gate, an opening and closing of a channel in the body, like a neurotransmitter, for example, right? We don't need to put neurotransmitters in there necessarily. The approach of somebody that's more functional is trying to just give you a little support, try to nudge you along, right? It's like running along the side of somebody when your child is learning how to ride a bicycle with training wheels. You're kind of along the side. You're just kind of like making sure they've got a little bumper on either side so you don't crash, versus just pushing the kid really hard, and saying, okay, let's see what happens here. So functionality. So why do I do what I do? And that question is everything, because I myself went through this. I myself was very desperate. I was very, very suicidal. I didn't know what I was going to do. I was really scared. And when you go into your doctor and you hear that nothing is wrong, because in medicine, if there's no diagnosis, there's no treatment. And thank God you have no diagnosis, because you have diagnoses like, oh, it's MS, it's Parkinson's, it's cancer, it's a serious autoimmune disease. That's scary stuff. And then the medical community will go after and do a type of treatment, right? They'll say, okay, you have this issue, then you take this treatment. However, if you're somebody that's going into doctors and you don't find any answers, right, you're in the gray zone. And when you're in the gray zone, you're in this area of just like, I feel tired, I feel achy, I feel anxious, my doctor says I'm crazy, or my doctor says I need to take a medication that is for depression. And whether that's true or not, that's not the issue. What we're talking about here is we're talking about the gray zone. And so what I really love in my work is working specifically with people in the gray zone, where they just like, I just feel terrible. There's nothing that the doctors know what to do. They really do want to help you. I mean, they really want to help. That's why they got in this profession. And thank God for all of the education that they've done and all the work they've done. But what we want to do is go and ask, what is the underlying issues here? So why I do what I do is to inspire you, to empower you, and I really believe that our first level is actually the body. And there's many other levels to this. There's the structural, right? There's the body, then there's the emotional realm, and then there's the energetic realm. And actually, the reason that I believe, if you believe in the creation story, regardless of religion or otherwise, that you're here for a purpose. You're here for a reason. It's not about getting up in the morning and microwaving your burrito and driving into traffic and buying a coffee and going and sitting in front of your computer. You're here to be the best musician or the best teacher, the best student, the best mother or father, the best daughter. You're here to empower the world. You're here to inspire people. You're here to let your music be played. And today in the modern world, we're so on the run and we're so on the go that I like to widen back and say, why are we doing this, right? Like if you're coming in here, and so Lucy's struggling like so many women, and the women are the canary in the coal mine because you have a lot more simple, or you have a lot more complexity. Us men are much more simple people, We kind of have an on-off switch. You have oscilloscopes and dials and levers and all these different buttons on your system. You have a menstruation cycle that happens every month. You can carry a life in your belly, So you have a lot more available to you. But in all of that extra cool wiring in your system, it's like having a way fancier sound system in the house. Other things can go wrong easier. So when we start to struggle like you, well, I'm anxious, I'm not really having a whole lot of hormone extremes, right? She's not bleeding to death, what's called oligomenorrhea, where you extreme bleeding. But, if you are having a little heavier bleeding in your menstruation, or if you're having breast tenderness, or you feel swelling in your belly or breast, if you feel like you're getting headaches and you're saying you get acne during the time of your menstruation, this is a very, very common thing. So why I do what I do is because I don't want to be the next doctor that fails you. We want to find out what is the underlying cause. And we look at all different types of approaches and modalities, whether it's nutrition, whether it's muscle testing, neurology, blood chemistry, all of the state-of-the-art things where we look at the brain and eye motion and all of this stuff. It all is related. None of these things are separate things. Another complaint she's having is she's having heart palpitations. And heart palpitations could mean that you have a heart issue, right? Or it could mean that there is other issues going on, like an immune system issue in the body, and it causes this weird symptom, right? Or it could be something you're eating that causes the heart palpitation. And 9 times out of 10, with a standard person that's walking in the office, it's the least scary of all of those. So all of you out there, when you start searching and Google and you're like, okay, heart palpitations and anxiety, and it's like, well, Google's like, well, you could probably die. You should see a medical doctor right away. And we want to rule that out. I think that's a first line therapy. I think it's really smart. Go see your physician, rule that thing out, check off the box, make sure you're not dying on us, It's very important. We want to know that. Step one, after we know you're not dying and you're like, okay, we have no idea what it is, then you start to say, okay, what could this be? So you're young, you're what, 23? And so I had an older gentleman come into me recently, and he was actually on the path to go get a defibrillator put into his heart, and essentially a pacemaker, because the nodes of his heart aren't firing appropriately. There was something electrical going on, is what they thought. And sure enough, it's true. There was an electrical issue. But what your body is made up is 80% water, just like Mother Earth. And the mineral content that is in your body is what allows you to produce electrical conductivity. If you were to have a big jug of water here and you were to put your feet in it, if I put electrical wire in there, a positive and negative, it'll run through your body, complete a circuit, and you'll electrocute. But if you were to put your feet into distilled water, meaning water without minerals, you'll put your feet in there, you won't get electrocuted. There's a great movie with Tom Hanks called The Green Mile, right? Where he didn't use any water, and it took this long, terrible process to eliminate this man through electrocution. We're not going to do that today. You're not disappointed. But if you were to take that same, your feet are in distilled water, you have an electrical current running there. If we pour salt in there, it'll fry your bacon really quick, because you're going to be electrical based on the mineral content that you have in your body. Well, here's this man, he's headed to get a pacemaker and a defibrillator and all these things going on that are built in. And I said, I don't know about you, but if I were you, I would try these 3 things first. Water, essential fatty acids, that's why we call it essential to life. All of your female hormones, all of the male hormones, it's like a cake. At the bottom of the hill, if you have a cake, you have to put components and things in the recipe to make the cake, right? So one of the primary things that makes the hormone cake is the fats, because all of those fats, DHEA, pregnenolone, and progesterone, and estrogen, all of those downstream things are produced by those essential fatty acids. So I said, let's give you water, let's give you a little bit of essential fatty acids, and let's give you minerals, because minerals make you more electric. Guess what? The man never had a pacemaker or fibrillator put in his heart. He saved himself thousands and thousands and thousands of dollars and the possibility of dying, because if they either open up your chest or they go in through the wiring now, orthoscopic type approach now, they thank goodness don't open you up as much. The technology for replacing broken bits and parts in the body has improved so much. Thank God for that. But he avoided all that the danger. He avoided all of the pain, and now he's healthier. So we always want to look at the big picture, and that's a big part of why I do what I do, is that this is simple, that this is easy, it's inexpensive, it empowers you, and it really brings us back to why you're on the planet, which is to be the greatest version of yourself, to be the greatest inspiration to others around us. And this is how we change the world. And that's why a big part of my conversation around working with people with body issues has shifted and changed. It's really grown. As I've grown in 40,000 patient visits, I've realized that above and beyond you feeling sick and terrible, I am not ever going to work on you or help you or support you unless I mention, hey, why are we going to do this for you? Like, what are you going to give to the world? Like, what is the real purpose of why you're here? And, because a lot of this breakdown in the human body is not just coming because of breakdown, it's coming because we feel unfulfilled. We're sitting in a job that no longer serves us. We're eating pizza and drinking beer because it's an escape from our reality. And people sit there and beat on themselves and they feel terrible about eating pizza and beer and smoking cigarettes or whatever. And I tell them, look, don't be so hard on yourself, If you're not frustrated or confused or anxious or depressed once in a while, I honestly don't want to talk to you because you're not paying attention, because the world is a crazy place. So the why comes back to, what are you here to do on this planet? I'm here to inspire and empower the ones that want to listen, and the ones that don't, that's totally fine. There's other channels. I'm not the way. There's many of us out there, and we all working together. If I help you, you go out and help your kids. And that's why we do what we do. So hopefully this was inspiring for you today, helps you understand a little bit more about this approach. And I look forward to seeing you at the next video.